In the last video, we were looking at directional terms. And we talked about the cardinal directions we use in anatomy and how they're pairs. Now, the first one I taught you was medial versus lateral. Now, this guy is heartless. See, it's a big empty cavity right here. But if the heart was there, let's give him a black heart. The heart would be medial to the lung, which would be right here. Now, his nose is right there. The nose is medial to eyes. And the nose, is it above or below the eyes? Is inferior. So basically the nose is to the middle and below the eyes. Oh, this is the neck right here. What is the neck compared to the heart? Well, the neck is above, so the neck is superior to the heart. Now, we also talked about anterior and posterior, as well as distal and proximal. Well, his hand right here, his arm should be here, his elbow would be there. So his elbow is distal to his shoulder, or his shoulder is proximal to his elbow. So I asked you to find these words. What was superficial again? Make fun of your favorite celebrity here. That is close to the surface. And what is proximal? Proximal is close to attachment. What's inferior? Inferior is away from the head is the technical definition. And what's lateral? Lateral is to the outside. So in lab today, I'm going to have an activity where you tell me if something is proximal, distal, superior or inferior, lateral or medial, superficial or deep. And I'll test you on that either on the lecture exam or the lab exam. I'll give you two things and I'll ask you what is the relationship between each other. So we're going to look at anatomical regions in this lecture. We might actually extend into the fourth part of the video as well. And you're going to complete an online activity for these. I did that with my face-to-face class. I'm keeping it for you guys. It's very important to learn what these regions are. Now, I know a teacher, he likes to give 58 regions on the first day to scare students away. I think these fancy terms are enough to scare people away. Instead, the reason I like these regions and to learn them day one is they help you later on in the class. We're going to deal with the frontal region, wherever that is. And there's a frontal bone, a frontalis muscle, a frontal lobe. So by learning the region, you learn 4 different structures right there. Or around your ear, that's your temporal region. You have a temporal bone, a temporalis muscle, a temporal artery, a temporal vein, and a temporal lobe of your brain. So by learning these terms, they help you a lot for the rest of the class. So, regional anatomy. Anatomists have specific names for each region, and they're typically based on Greek or Latin. So this really is a language class. We're just using a dead language in Latin, or my Greek relatives are going to be mad at me, a language that has no other close relatives in the Indo-European language tree. So we're going to be using Greek or Latin-based names, and that's so everybody can understand them. Now, according to one book we used at the school, I think there's 58 terms. I've narrowed them down. I have both a study guide for lab and a study guide for lecture. Those are the regions that I really, really care about. So go with the study guide. So the head is the cephalic region. And it's actually divided into cranial and facial. Now, facial is something around your face, or the bones that make up your face, where cranial are bones that are around the head. That doesn't make any sense. Let's look at a skull. So here's a skull, and we're looking at it from the back. Now, this yellow bone right here, this red bone right here, this brown bone right here, this green bone, one of those didn't take it off, and the blue bone are all surrounding the skull. So they're said to be cranial. So all these regions that are around the brain in here would be cranial. So remember those bones, this yellow one, this green one, this brown one, the red one, and the blue one? They're all around the brain, so they're said to be cranial. So that's one of the head regions. The other ones, this magenta, I guess it's plum, yellow, white, orange, another orange, oh, another white. Those are all making up your face, so they are called facial bones. Since I already have the skull up, we might as well use it. This way is anterior, this way is posterior. Now, this region right here, that is frontal. So basically, your forehead is your frontal region. Now, the side of your head right here, do you know that's called your temple? I knew that when I was a little kid, but never made sense. Well, it's because of this brown bone right there. That's your temporal region. And this blue bone back here, that's your occipital bone, so that's your occipital region. Congratulations, 40 minutes into your first anatomy lecture. You learned 3 bones, 3 lobes, a bunch of blood vessels, probably some nerves in there too. So frontal is your forehead, temporal is the side of your head down here, occipital is the back. Now the last one is harder to explain. It's this big green bone. That's your parietal bone. That technically is a region, but it's not in your lecture notes, so I won't go. So if we look at the sky, this would be the frontal, his forehead. And around the side of the ears would be the temporal, and then we can't see his back. Now if you look here, there's actually sub-regions. So your ear, it has an oris or an otic region. And we're not going to go over most of the sub-regions just because it gets really, really confusing. Now, the facial bones are the bones that are around the face. So they get to name the facial regions. Now, there's several of them. So your eye sockets are your orbital region. Right there. So this right here is orbital. Whereas your mouth, right there, is your oral region. Your cheeks, right there. Your cheeks right there. Those are your buccal or buccal. I learned buccal. I've heard buccal more often than buccal. So that's how you spell it. And I personally just like this because there's a muscle called the buccinator. It reminds me of the Terminator. I think I've watched the first 20 of the Terminator movies, then lost interest. So then lastly, this is the one that I always think is funny. I like funny terms. This is your mental region. What the heck? Well, if we scroll down a little bit on this page, your chin in Latin is actually your mentum. That's where we get mental region from. And again, that's one of those silly little things. I'm like, how the heck is that mental? And it has a silly structure. The mental protuberance is a little outpointing bone on your chin. And then you have a couple holes called mental foramen in your mandible there. So it's actually an important one to learn. So we've gone over 8 terms so far. We have, or 7, I guess, the frontal right here, the temporal. Occipital is the back of the head. We talked about the orbital, which is your eye, the oral, which is your mouth, the mental, how the heck is your chin, and then the buccal or buccal. Now there's other ones that we're going to do. And we'll probably talk about some other things like we'll do oculi and nasal later on in the class, but that's good for now. So we're now going to look at the front side or the anterior of the trunk. Now, your neck is called your cervical region. So we have our headless horseman right here. There's the neck. And cervix actually means neck in Latin. So that's where we get the term cervical region. It's the neck. Now, there is another organ. It has a neck. That is why that organ has a cervix on it. Now, the actual thoracic cavity, let's draw an imaginary line right there. That imaginary line is the diaphragm. Everything above the diaphragm is your thoracic cavity. Everything below the diaphragm is your abdominal cavity. Now, there's regions upon subregions. We're going to look at 4 subregions of the thoracic cavity and 3 subregions of the abdominal cavity. The first region we do is the armpit. The armpit is called the axillary region. And that's pretty much under your arm right there. Hope this guy wears deodorant. And on top of the shoulder is your deltoid region. So your deltoid is the top of your shoulder. Your armpit is your axillary region. Now, most of the thoracic region is made up of a subregion called the pectoral region. Sorry, it keeps doing that. So this whole thing is the pectoral region, right there. Now you'll notice there's subregions. That subregion actually has a subregion. We're not going to worry about those subregions right now. I think most of you know those subregion names anyways by now. But we'll just say that this is the pectoral region right there. Now this green right here is your breastbone, and that's the sternal region. So the sternal region is named for your sternum. The pectoral region is the sides of your chest. So our upper body, or our upper thorax regions are axillary, which is your armpit, deltoid, which is the top of your shoulder. Pectoral is the whole lateral side of your upper thorax, and sternal is the middle. So after admiring his abs right here, we're going to look at the abdominal, and this is actually abdominal pelvic. So I'm going to be nice. The one region we have here is your umbilical region. Nobody has ever gotten the umbilical region wrong. It's your belly button. Please don't be the first. The next region is actually a very important region to learn its name. Inguinal. I've seen a lot of videos that call it inguinal, but it is inguinal. And it's defined as your groin. So what's your groin? Your groin is this crease right here. I'm glad this guy has a lot less body fat than me, where your leg meets your pubic area. So that's actually inguinal. There's a canal right there. Green on green works perfectly right. There's a canal right there that the femoral nerve, femoral artery, femoral vein all enter and leave. So it's actually a very important spot for doing injections. Now, pubic. The pubic bone is right here. This is the pubic bone. And this is considered the pubic region. Now, this whole region is pelvic. Pubic and pelvic sound almost identical to me, and I've been teaching this forever. So your pubic region is the name of the bone. Pelvic is all of this, inguinal and pubic put together. Now, I've seen some diagrams online that put the inguinal region up here, and that doesn't make sense because that's not your groin. Your groin is where your leg crest is right there. So don't worry about being too specific on it. For me, what I want, this is inguinal. Okay, and then pubic is in the middle. So, pop test. Just kidding. Let's do a little assessment. Tell me what these regions are. So A is your armpit, B is the shoulder right there, C is the midline, D is lateral to C. I do not see where I wrote E. Oh, E is your belly button. F is this canal right here at the crease. G is around your ear. H is the back. And I was going to be where her pimple is, but I can't put a mark there. And we'll go over these on the next video.